It's said in the medical literature that 10 to up to 25% of chronic low back pain could find its source in the SI joint. And yet the SI joint is often misunderstood, misdiagnosed, and when it is diagnosed, people usually aren't given the full picture of things that they can do to get back to feeling amazing. I'm Dr. Brant Pedersen, and I've helped thousands of people with SI joint issues in my Northern California office. I've also put some videos on SI joint issues up on YouTube, and I've received thousands and thousands of comments. What follows is viewer questions that have come out of those comments, the ones that have percolated up as frequently asked questions, and I'm going to answer those. And don't worry, if it doesn't feel like all the questions apply to you, I've indexed every question down below into a separate chapter. So if you get to a question that doesn't apply, just fast forward to the next one. Before we get started, I want to thank all of you who have subscribed and commented on my channel. It's because of people like you that we're able to make this more of a dialogue. Now let's get started. So this first question comes from a viewer, Glamour and Grapes. And it's a great question because a lot of times we can feel like, wow, is this part of my body not big enough to cause that big of a problem or a big enough pain, especially for this long? So they ask, is it possible that I've had this for as long as 9 years? It looks like they've done tons of things, but nothing's really made it completely go away. But 9 years seems too long for something as small as a ligament sprain. So the thing is that, yes, it's ligaments that hold the SI joint together. And certainly we can have a sprain from an injury like a fall that can cause shearing and a sprain of the ligaments in the SI joint. But the thing is that it's what we're doing day after day that continues to create that injury and allow it to persist. And so it's not that the original injury was so bad and couldn't heal, but if we continue to do things to shear it, if we don't do things to provide stability to it when it needs stability, and we're stretching, doing yoga, things like that, that might be taking us farther away from our goal of getting back stability in our SI joints, it can last a lifetime. So, fantastic question. If we don't get in and do what our body needs, and the first thing is to get a proper diagnosis, but if we get the proper diagnosis and we have SI joint instability and it's causing us pain, then what we need to do is the things that I've detailed in my other videos. I won't go through all of those here. But yes, I see patients that have had this pain for a decade or more, and we start doing the right things and they start feeling better almost immediately. It is a road and a progression to get back out, but they can turn the corner and start feeling better by starting to do the right things. So, fantastic question. This question is one of my favorite questions, and it speaks to, you have to have a proper diagnosis of something before you go down the road to treat it. If I want to get to Hawaii, I at least need to know the direction of Hawaii before I start going, right? And I think way too often in healthcare, there's a scant exam done and a very minimal history, and then treatment is, we're off to the races with treatment. And so I'm a big believer in do a good exam. So I can't teach you to be a doctor through YouTube. That'd be pretty cool if I could. But I'm going to show you one test that I do in my office that really helps me start to differentiate and go down a path. Is something low back in nature, or is it coming from the SI joint? So the test is called the belt test. We'll bring a buddy of mine over here. And these are your SI joints. These are called your ilium here. And the test is called the SI belt test. And what we're going to do with it is I'm going to have the patient bend over and head towards their toes, touching their toes. And as they do that, they're bending not only here and putting stress into their SI joints, but they're also bending in their spine. And so there's, how do we differentiate if something is coming from the lumbar spine, a low back issue, versus something coming from the SI joints? So the SI belt test looks like this. I'll have a patient bend down towards their toes and come back up. If that causes them pain, then I'm going to take and stabilize. I'm holding, these are called your ASISs here, these bones that are on the front of your hips. I'm going to hold this. I'm going to put the side of my thigh or hip against their sacrum, and I'm going to really hold back with my hands as they bend over. And what I'm doing there is taking the SI joints in the pelvis. It's not going to move. All the motion's going to come from the lumbar spine. If they have a lumbar spine issue, like a disc issue or things like that, a facet issue, that is going to cause increased pain, or at least the same level of pain as they bend over. But if they have primarily SI joint pain issue, what's going to happen with me stabilizing their pelvis is that they are going to have less pain instantly. Usually what I'll see is it's 75% gone or completely gone. Gosh, I don't have any pain when I'm bending over and you're holding like that, doc. So immediately I'm thinking SI joint pain, and we're going to go down that avenue. There are other tests that I'm doing during my exam, and I'm probably going to make a video that shows what I do for an SI joint pain examination of a patient, all the things that I do. But this is something that you can do at home, you can have someone help you with, and see if it seems safe for you to try. Seems that lets you know if we're aiming more towards lumbar issues or more towards SI issues. Great question. I have a question from Rick Heath that said, would SI joint issues cause my groin to be numb? I've had really bad pain in that area. So numbness, frank numbness, when it is in an area called, and it could be the groin, but an area that would touch a saddle if you were sitting on it, that's called saddle anesthesia. That is really important. You go immediately see a doctor and get that checked out, like go to the ER. Okay, saddle anesthesia or loss of bowel or bladder function, those are both medical emergencies, go to the hospital. Also numbness, that's not something that we usually see with SI joint pain issues. So we might have some pain that travels in different places. It can be down the back of the leg, out into the hips. It can certainly be over the SI joints or in the low back. But we don't usually see numbness. And it's important to distinguish between tingling and numbness. Tingling is kind of pins and needles, kind of like something fell asleep. And numbness is kind of Novocaine stuff. But whenever we hear about numbness, go right away and get that checked out by your doc. So we've got a question from Kathleen Johnson. She's saying, in your videos, you've talked about a shearing of the SI joint. Can you explain what that is and what positions or movements would cause shearing? So shearing is where one of the SI joints, or one of the hips and ilium here, is going backwards as the other one goes forwards. And it creates this one's coming back, one's going forward, the shearing motion of the joints. So examples of that would be something like a warrior's pose in yoga, right? Where someone's here. One leg's going forward, the other one's going back. Doing lunges, doing a stairmaster, doing elliptical, cross-country skiing might count as that a bit. Sleeping on your belly in bed with one leg up, kind of out like that, it's pretty shearing and stressful to the ligaments around the SI joint. Cause problems with someone with SI joint instability. So things like that can bring one of your legs back and the other one forward. Now, an example of something that doesn't do it, but you might think it does, is someone doing a squat when they're in the gym. That is not shearing the SI joint because both legs are working together at the same time, right? So those type of things are fine. You just have to pay attention to where one leg's going back, the other one's going forward. Those are shearing motions. We having fun yet? I love my job. Thank you for watching. If you haven't subscribed, please, that'd be amazing. And also, throw a comment down below. That's how I got the idea for most of these questions. So love it if you'd comment. This question comes from Holly Gigglewind. The question is, would two different leg lengths, there's so much in this question, two different lengths of legs also cause instability and pain? I was thinking about my friend should put a heel lift in one of their shoes as well as using the belt. So let's start with leg length differences. You may have been to a chiropractor, or you may have felt it yourself, or had a physical therapist or physio tell you that one of your legs is different length than the other. So really important distinction right off the bat. There are two types of leg length inequality or leg length difference. There's a functional short leg and there's an anatomical short leg. An anatomical short leg means that your bones are actually different lengths. That can be caused by like a different rate of growing of your bones. Sometimes if someone has a really bad fracture in their leg while their bones are still growing, it can cause the bones to grow at different speeds. Sometimes we'll see it if someone has a really bad injury where they shatter the bones in their legs, and a surgeon has to put them back together as best they can, even though it's just little chips of stuff. So sometimes that can cause a leg length inequality. Sometimes we'll see it after surgery, a hip replacement, a total knee replacement. Sometimes, when they're in there doing the carpentry amazingness of orthopedic surgery, sometimes stuff just doesn't get back and exactly line up. So we can see anatomical leg length inequality, and we can tell on an exam or on x-ray if there's an anatomical leg length difference. But most of the time when people have a leg length difference, it's functional in nature. And what that means is that at the SI joints, if that SI joint is rotated or stuck backwards or forwards, that because the hip joint comes off of that pelvis, it can give us a relative view that there is a shorter or a longer leg. Example I'll show here is if the right SI joint was stuck back into what we call a posterior inferior orientation. So the PSIS has gone backwards and down. These muscles that come off of here, one of them called your quadratus lumborum, coming off your 12th rib down your lumbar spine and hitting here on the iliac crest, that muscle gets tight. You might notice it in here, really tight. And when that tightness happens, it hikes the hip up, kind of does this. Wouldn't do this necessarily with the head, but it would hike the hip up. And when it hikes that pelvis up, it's going to take the hip joint with it, and it's going to make that leg look short. Again, that's a functional leg length difference, not an anatomical leg length difference. So, would two different lengths of legs cause instability and pain? Absolutely. If there is a functional or an anatomical leg length difference, it can cause all sorts of issues. If it's an anatomical leg length issue, it's really important to get it diagnosed and balanced out, because I see that in my office lead to tons of chronic pain that people don't know the cause of. They come in and we go, wow, you've got an anatomical leg length difference. And we give them something like this, like Holly mentioned in her comment. This is, $10 on Amazon. It's a heel lift, and you can it's got different layers in there, so you can make it different heights. And you just take and put this in your shoe underneath whatever pad is on there, on the inside of your shoe. And all of a sudden, that anatomical leg length is corrected and your pelvis is even. But that is not something that I usually recommend for people to do on their own without having a doctor check them out to see, is it a functional leg length difference? Again, that is 99% of the stuff we see is functional leg length difference. Heel lift is not needed. The 1%, the anatomical leg length difference, that's really needed, but you want to make sure that a doctor or a podiatrist, someone is checking that out to see if that's what you need. So, great question, because it brought us into leg length differences and understanding that. And maybe someone's told you have a short leg, you have a long leg, and you didn't understand what that meant. A lot of times if someone comes in with a functional short leg, by the time they leave my office, it's balanced out and their legs are even. And the question is, how long can they maintain that? If they don't maintain that and we need to keep adjusting it, then we need to look for what is causing that pelvis to get stuck in a wrong position. Not that we need to just be adjusting them over and over and over again. We need to figure out what's causing it to go out. Do they need exercises? Do they need a support in their shoes? Are they doing something posturally that's wrong? A whole bunch of things we look at. But that's how we look and correct a functional leg length difference. It certainly can be a cause of SI joint pain. Next question comes from Nate Big. Would running cause this to act up? Does anyone know? So walking and running are both a one-legged activity. Okay, so the majority of the time you're just up on one leg and the other leg's passing through. The thing is that if I have weak gluteus medius muscles, my gluteus medius muscle lies over here on the side of my hip, and it takes and stabilizes my pelvis as I come up on one leg. So when I bring this one leg up, the fact that my pelvis doesn't drop this way is because of my gluteus medius on this side. A lot of times when people have chronic SI joint instability issues or chronic SI joint pain issues, it is because they have weak gluteus medius muscles. There's a whole reason for that, and I talk through it in one of the videos below on the 4 exercises I recommend for SI joint pain issues. But when someone is running and that is causing them, or walking or hiking, things like that, and that's causing them to have increased SI joint pain, a lot of times we'd be thinking that they have weak glute medius, and we might see that they walk or run kind of where their hips go out to the side as they do that kind of like maybe a model walk. Not a model. So that's the reason we might think that running would cause that. In general, running shouldn't cause issues with the SI joint unless someone has glute medius weakness or they're having issues coming from their feet. And there's another video down below that talks about the connection between the feet and how that can send an ascending problem up and cause instability at the SI joints. I love this question. How rare is it to have SI joint dysfunction bilaterally? And what I see more often than not in the office is someone comes in that says, my pain is at my right SI joint, but like a month ago, it was on my left SI joint. What's up with that? Or it kind of seems like it goes back and forth. And so it's really common. And I think this has to do with people, a joint being kind of hypermobile and moving too much, maybe the other one being stuck. And then that kind of shifting because people kind of favor one side or the other. And so the pain can kind of seem like it shifts back and forth. Sometimes, I find most of the time, it's usually a problem primarily with one side, that when we fix that one side, but also do a little bit of stuff compensatorily to the other side, we get them both to calm down. But it is primarily going after one side. Could you have it on both sides at the same time and have pain on both sides? Absolutely. So this is a great question, a sad question for me. I get a lot of questions on, hey, where can I find the sacroiliac belt that you recommended? It's no longer available on Amazon, or it's only available in small, or something like that. By the way, the one that I see is needed the most size-wise is a medium. And I did see another question that asked, hey, if I'm right on the edge of needing one size or the other, should I go down a size or up a size? What I recommend is to go up a size if you're right on the border. The reason is you can take and cut this long tail off here if it's too long to make it so it fits you good, but it's you can't add to it if you need to. And the problem is if you get it too short, this part of the Velcro here, if it doesn't match all the way up, then instead of it being a nice smooth surface, you're going to get this Velcro pinching into you. It's not going to be comfortable. I wish that there was another SI belt that I could recommend to you guys. What I have seen is that there's 3 things that make this belt work really good for people. One is the quality of the Velcro is amazing, so it doesn't wear out. A lot of other belts, they're just using like knockoff Velcro, and so the Velcro portions of it wear out. After a couple weeks or a month. So if you do need to wear it, it just should last. I've seen people wear these for years and the Velcro stays good and stiff. Second is that this material that's on the inside of it, it's really good at not slipping, but not being aggressive on your skin or over the top of your clothes. So that's fantastic because you don't want the belt to slide up or down. And these seem to do a really good job of not doing that. Lastly, this little strip that's here on either side, what that does is when you go to bend over or sit down, that edge rounds up like this, so that instead of your skin getting kind of bit by the edge of the Velcro, it just has this nice radius rounding of the webbing of this soft material, kind of a neoprene around the Velcro. So I love these. They're fantastic. It's what I recommend, and I see a lot of people come in that have gotten something that's available that doesn't work as well. If you can get your hands on this, I recommend you do. I am going to try to find a way to get another option of a place that you can buy them. I'll put the link down below there as soon as I do get it. As another option because it seems like Amazon is out quite a bit or doesn't have the size people need. So this question comes from Lorena L. And she says, thanks for the explanation. One question, could pregnancy and natural childbirth, child delivery, cause SI joints to stretch and cause pain? And that is certainly something that we see quite frequently. See, there's a hormone that is released during pregnancy. Its highest level is in the first trimester. It's called relaxin, and it helps to, amongst other things, it relaxes the ligaments so that certainly in natural childbirth, that the pelvic bowl can expand to allow the head to go through of the child as it's being delivered. But that hormone continues throughout pregnancy, continues up to 5 months after pregnancy, and it actually continues up to 12 months in some sources after breastfeeding, after the end of breastfeeding. So some people can have that relaxin hormone in their body for years, and that relaxin hormone makes your ligaments more stretchy. And so that can certainly lead someone, especially someone that's already more on the scale of being more ligamentously lax, can make them have kind of recurrent SI joint issue pains. So an SI belt can be a great help with that. Certainly a pregnancy belt, and you can look, talk to your OB about that. And then doing the things that don't shear the joint. So we might feel like, gosh, I want to do yoga because that's good for me. And yoga's fantastic. But if you're someone that's got SI joint instability issues and ligament stretch issues, that's not going to be the thing that you want to do at that time. So, great question. This question, thank you. After using the sacroiliac belt for 2 to 3 weeks or so, can you go back to doing your yoga routine? The thing is, every person's different. So it really depends on how you're feeling. Is your pain gone? And sometimes people can get back to doing stuff that they love to do sooner if they're wearing the SI belt when they're exercising. And that's another question I get is, hey, can I wear the SI belt when I'm exercising? What I see with my patients is yes. And I have people even, swimming or riding their bicycle as they start to get back to these things that they love to do. They can wear their SI belt when they're doing that. This question's from Juliana and says, so when I'm lying down, if I bring my leg to my chest and then slowly straighten it out when lying on her back, right? I'll hear a loud crack. Is that the SI joint? That's a really good question. Sometimes people with SI joint instability will hear popping and cracking as they move around, but that can be something else, which is called like a snapping hip syndrome. So it's important to be able to rule one out or the other. If you feel it kind of coming from the front of your hip as you bring your hip down slowly and it feels like it's right under your hand here, that's your hip joint. If it feels like it's coming more from your backside, that a lot of times is more of your SI joint. I'm trying to put together a video on snapping hip syndrome and what that is and kind of things you can do for it. But that sounds like possibly more of what she has. Do you like what you've seen? Please comment and subscribe. I love engaging with my viewers. I believe that it's only through educating ourselves on this one precious body that we've been given that we stand the best chance of living a life that's pain-free and without limitations. Until next time, take care.